next stroke, since your hair is called knuckling. It's the same position where you're setting yourself up as an open fist, but it's a knuckling move. You throw your hand out like a tea time. I think of pinky tea when you're having tea or doing your hand like this. So remember to rotate your hand in that fashion. So your hand is like this. You rotate it out. It's kind of flat on the body now, and then you sink back in with those knuckles. This is called knuckling. This one's a little hard to master, but once you master your hand movement, it's a very, very nice stroke. When you get to the top, just nerve stroke back. Again, that open fist is where you start. Knuckle it out. Knuckle it out. Knuckle it out. Your pressure's coming in when you're dropping your knuckles into the body. Nerve stroke back. And you would actually shingle to go to the opposite side of the body. Remembering to dance across the table. Shifting your hips. And breathing. Dropping that hand in again, keeping that wrist straight, and knuckle out. Since you're here in this position, you work opposite body. This is called 3 count. You're just dropping your fingers right into this little area, fatty tissue here in the trap area, and you're just 1, 2, and 3. 1, 2, and 3. 1, 2, and 3. And shingle around so that you can get to the opposite side of the body. That opposite area, 3 count. You can shingle back down the back, and the next move is called horizontal push-pull. It's very important that you use your body here. Some students will go up and down or side to side. Whatever works for you is fine as long as you are using your body. And you really sink in and you push and you pull. Push and pull. Push and pull. Really pulling the tissues. You can see how the tissues are rolling here under my hands. This is called horizontal push and pull. And you can even go lower with your stance. I happen to have a knee injury, so I can't go as low as I need to go. But I'm still using my body carefully. The next thing I'm going to show you is a forearm move, and then we'll go into our other strokes. The forearm move is definitely a dance, and I'm just going to expose a little side tissue here. This forearm works beautifully. You could do the whole body. You could actually take the forearm move and go down to the leg and then back up to the shoulder. It's whatever you want to do. I'm just going to show you in this area right here, right now. But it's a dance. You take a little bit of oil. You put a little bit on your arms, right underneath the forearm area. Mind you, this is not elbow work. This is forearm work. I have students tend to sink in those elbows too deep into their clients, and you can't gauge with your elbow. You can't really feel the tissue and you wind up hurting them. So make sure that you are gauging with your forearm. I like to start here at the lower part. Take your forearm, make sure your wrist is nice and relaxed. I see a lot of students do this, and I go around popping hands to relax their wrist. So straight into their rector spinae again. Coming right off the shoulder, dropping this down. This arm comes up and around. It's like a little dance. And you can do this on both sides of the body for demonstration purposes. We're just going to show you this one side. It's a beautiful stroke. And you can, like I said, take it all down the side of the body.